Very good evening and welcome to another episode of iMed. And on today's episode of iMed, we're back to the topic that had engulfed the entire world since 2019. Yes, that is the COVID-19 virus. And today, with a primary focus on the new variant, the Omicron variant, we are going to go into further discussion about the booster and the vaccines available right now. So with us, we have an expert in the house. That is Dr. Hemant Herath, the Deputy Director General of Health Services from the Ministry of Health. A very good evening to you, Doctor, and welcome to iMed.
Good evening. Well,
Doctor, to start off the discussion, let's talk about Omicron. How did this variant come into being? Where was this detected? Let's start it off from a global context.
yes, again, talking about Omicron variant, firstly we have to keep one important fact in our mind, that is, it is one variant of the COVID-19. That means genetically this is a COVID-19 virus, but slightly different from the other type of viruses, and this is a natural phenomenon. From time to time, this kind of different or slightly different, genetically different variants of viruses can emerge from time to time. So now this so-called Omicron variant was first detected in South Africa. However, it is still, we also not sure, and up to now data still in a way does not indicate whether it is or it was originated in South Africa or it was first detected there, because once it was detected within a very short period of time, it was detected in many parts of the world. So whether it was originated in South Africa and spread into other countries, or whether it was detected there. But however, now we know that over 60, almost 63 or about more than 63 countries all over the world have detected this variant in one person or the other during the past few weeks.
Yes, Doctor. So initially detected in South Africa and then spread across the entire globe, and now it has come to Sri Lanka as well. So if you look into the local context, how has Omicron impacted Sri Lanka so far?
I would say that the impact of the Omicron at present is hardly any or minimal, but possible impact in the coming days could be little bit serious. That's what we want to, because at the moment we have detected only one case. That is also based on the strategic surveillance activity that we carried out during the past few weeks. That we found it, and we are continuing our surveillance activity. So far we have not detected, but if this virus comes into the country and get established, basically according to the available information, it appears that it could be giving mild symptoms compared to milder symptoms compared to Delta like other variants. However, the spread of the disease or the rate of transmission appear to be very high, and as a result, the total number of patients infected with this variant could be very high, and even if the mild symptomatic patients or number of people who are having at least mild symptoms are going to get admitted to the hospitals, then definitely our health services are going to bear the burden. Firstly, to detect and then do the quarantine, contact tracing, all other public health activities, and then the hospital-based management of these cases. So therefore, we are vigilant and we are always trying or looking or preparing for the worst scenario. At the moment, we are very comfortable as far as this variant is concerned, but we are preparing for the worst scenario.
And Doctor, from different sources we have heard that this Omicron variant could be the last stage of the COVID-19 virus. Now that the symptoms have gotten milder and the rate of transmission has got increased, Does that really mean, is that statement legitimate if you say that this might be the last stage of COVID-19 virus?
I am no expert to give a concrete answer to that, but I have heard from relevant experts in different fora that although these kind of statements are made, most of the experts' opinion is on the contrary. That means this could be the last one, but it could be other way also. Because even once the alpha or beta or like other variants were detected, finally when it came to the delta, there were so many people who were forecasting that this will be the last. However, the Omicron came, and you know there are so many other in-between variants detected and named, but they were always they were labeled as variants of interest and not variants of concern. So therefore nobody talked about it, and therefore it will continue. So if it is the last thing, that will be the best for us or for the entire world. But at this moment I don't think that we should be in a hurry to come to that kind of conclusion.
Yes, Doctor, and rightly said as well. I think it's important that we continue to take precautions and take all the safe and health guidelines strictly and adhere to them strictly, no matter whether it's the last stage or not. I think it's important we adhere to the safety guidelines that have been set by the authorities. And Doctor, let's also focus on this new booster. But before we come into the booster, the current vaccines that were available in Sri Lanka, do they provide immunity or against this new variant?
Yes, again what we have to start with is that how the vaccines work in or against this virus, the so-called COVID-19. Up to now, there are a number of vaccines, and apart from one major vaccine, almost all vaccines were available in Sri Lanka and people have been given. And all these vaccines worked in a manner where they will boost the immunity of the individual and thereby prevent or reduce the possibility of going into complications or the risk of dying of COVID-19 pneumonia or other complications. That is the main aim of these vaccines that we are administering at the moment. However, none of these vaccines are going to protect you from infection. That is, 100% protection cannot be guaranteed even if you are vaccinated. That means you are, if I put it in a very simple way, if you are wearing a helmet while riding a motorcycle, you will be your head will be protected, and thereby your life also will be in a way greatly protected, because but that will be only if you meet with an accident. But that doesn't mean that you are 100% protected by wearing the helmet, and helmet will never prevent the accident. Accident is determined not by the helmet but by other factors. Likewise, this vaccine will protect you, but that will never, or in a way, it will never 100% protect you from getting infected. So we have to keep that in mind when you are describing. So up to now, what available data indicates that all vaccines are even at present are effective against this Omicron also, to prevent the possibility or the risk of complications. As far as those aspects are concerned, it is effective. But as I told you, none of these vaccines will protect you 100% from getting infected from Omicron. So that is the current position. So if somebody says it is not effective, I won't say that it is true. But on the other hand, you have to adhere to the health guidelines to get yourself protected from infection.
Definitely, Doctor. And if I may ask, what was the need for a booster shot to be introduced? Is it that when you take the vaccination, is the benefit of the vaccination going to expire after a period of time? Is that why the booster was introduced, or was there another reason to introduce the booster shot?
Yeah, you are correct. Basically, it was the reason. That is, the disease is new, the vaccines are new. We are not, from the beginning, we were not 100% sure about how these vaccines are behaving in our bodies, and also how the virus is going to respond to these vaccines. So, now we know that certain vaccines like the measles vaccine and so many other vaccines, once you administer relevant doses, you are going almost a lifelong protection, and you will be not only get yourself protected from getting complications or other getting killed by that disease, but also you will be protected from getting infected. But these vaccines as well as this virus is behaving in such a way that the immunity that is supposed to be developed within the body it appears that it is not lasting long compared to many viruses that we were talking about. But this is not something unique for COVID-19 infection. It is applicable for many similar viruses. Like even the influenza virus, you know that there are variants and new strains are coming, and therefore annually you will have to give the influenza jab in the countries where it is prevalent. And likewise, these vaccines against the so-called COVID also behave in that manner. So, what we have found at this moment is that the immunity developed after getting this so-called immunization of 2 doses appear to be waning gradually over the time. So, the experts have recommended another booster dose at this moment after 3 months, and probably it will go on. Sometimes it might we might have to give another dose at some other time interval. We do not know. That is the current position.
Doctor, like you mentioned earlier, most of the vaccines were available in Sri Lanka, like Moderna, AstraZeneca, Sinopharm. Most of the vaccines were available in Sri Lanka when it comes to the initial 2 doses. But when it comes to the booster, we only have the Pfizer booster available in Sri Lanka. So, was it like recommended by international organizations to go ahead with one type of booster shot for everyone who was vaccinated by different types of vaccinations?
These again, there are different opinion airing in different fora. However, all these strategies are based on the recommendations of the National Advisory Committee on Communicable Disease, which consisting of not only health ministry officials but also other epidemiologists and clinicians, university academics, and so many other experts in different fields. And our decisions are made based on the recommendations made by this committee, and that committee recommend that by going through the available data after much deliberation, that this type of RNA type of vaccine is one of the best type of vaccine to give this additional immunity, especially considering that different types of vaccines are administered to different people in different parts of the country. As giving a common vaccine, then it will be the best vaccine would be this type of vaccine, and for us it is the current Pfizer vaccine is what is available. So, as an RNA vaccine, we are administering it, and there are so many opinions going on about the other vaccines and how whether it is available or not. But finally, we decided to do it based on the recommendations of this expert committee.
Right. And also, doctor, there's a fear among the public about the after effects of the booster shot. Compared to the initial 2 doses of the vaccine, most people tend to have more repercussions after the booster shot. Is there truth behind this, or is that just people talking about different opinions among them?
Yes. Again, I would say that the most of these fears and also certain misbeliefs are probably because of the infodemic, where the different types of information is circulating in different parts of the world and then coming into Sri Lanka, and not only through these so-called IT and the internets and other type of information channels, but once it comes and established in the country, it goes from person to person through other means also, and sometimes people who are having some kind of different opinion, different agendas and also different beliefs, they will try to propagate that also. So anyway, what as a scientific person, what I would like to say is that so far we have not got any concrete evidence to say that there is any major side effects due to this booster dose. Only what we have found is mild symptoms like fever, myalgia or body aches and pain or similar types of things. In addition to that, there could be immediate reactions like faintishness and then type of kind of, because of the pain and the kind of fear that even if I were given a chance to get an injection and a pill, I would definitely prefer the pill rather than getting the injection. Yeah? So likewise, the people sometimes they are reluctant, or there is a natural hesitance to get the so-called injection compared to a oral pill. So therefore, the people, we have seen that all these have contributed for this hesitancy. However, I would say that so far no major reactions or life-threatening conditions arisen after getting this infection. Now there is a report today also that person has died after getting the infection. So now we have to establish whether the person may have died after getting the infection, but how long after, and was it really whether the injection contributed to his death or any other reason. So until that is established, I don't think that we can conclude on those things. But I would again say that this is safe, and you are always welcome to get this, and you will be protected by getting this booster vaccine.
Yes, doctor, and like you rightly mentioned, I believe there's a fear psychosis induced by the whole idea of an injection especially in a country like Sri Lanka. That idea is there. But just to educate our audience, can we remind our audience as to which groups are eligible to get the booster shot right now in Sri Lanka?
Up to now, anybody above 20 years, today the Director General has already issued the guidelines. Anybody above 20 years, if they have completed 3 months after getting the second dose of whatever the vaccines that they got primarily, that is first dose, second dose, whatever the vaccine, if they have completed 3 months after getting the second dose, they are eligible to get the vaccine. Then the next thing is anyone above 18 years are also eligible, especially those who are in an institution or factory or workplace or where, because we have to make sure that before the Christmas, before leaving for Christmas, the ministry has already decided to give the booster dose to anybody who is above 18 years, those who are working in factories and workplaces. Then the students who has got the first dose of vaccines above 16 years are also now getting the second dose. So the booster dose, we don't get your third dose at the moment, they will be getting the second dose. and the children about 12 years will be getting the first dose, but again all these things will be announced very soon once the proper arrangements are made. But at present, anybody above 20 years are eligible to get this vaccine if they have passed that time period, and anybody above 18 in this factory and workplace setup are also eligible.
And since we are on the subject of eligibility, are groups like pregnant mothers, or if we talk about people with non-communicable diseases like diabetes and cholesterol, are there any parties that should not get the booster shot as per the recommendations?
No, none. That is, I have to very firm about it, because if somebody is having a disease, they are the people who are really need to get it first. Only contraindication would be if the person is seriously or severely allergic to components of this vaccine or similar components, and if they have shown, if any person has shown any serious reaction for this injection during their prior injections and other things, again we give the injection under medical care, emergency care. But if the clinicians are of the opinion that you should not take a risk in those patients, then it could be, you can avoid it. But all others are definitely can get the vaccine, because so far, because of this specific arrangements, we have not got any major reactions or any allergic conditions or life-threatening conditions after getting this booster vaccine.
So then, Doctor, I believe it is imperative that we all who are above the age of 20 go out there.
Yes. And also, you know that initially people were reluctant to get other vaccines, expecting to get the Pfizer vaccine. And now Pfizer vaccine is available. So I think now it is time to get the Pfizer vaccine and make sure that you are protected.
Definitely, Doctor. So I believe it is imperative to everyone who is above the age of 20 to go to the nearest vaccination center and get the booster shot, as we have Dr. Hemantha Herath recommending that there are no major concerns when it comes to the booster shot that is provided by the government. So today we were in conversation with Dr. Hemantha Herath, Deputy Director General of Health Services, Ministry of the Health, and today's discussion focused on the new variant Omicron and the new booster shot that is available to everyone out there. So I would like to extend our heartiest gratitude to Dr. Hemantha for being here with us today.
Thank you. Thank you for inviting this very important conversation. Thank you.
And we here at ChannelEye, we always have our eye on the latest developments when it comes to the medical field, and stay tuned with iMed for more developments. It's good night for now.